Hello, I'm Dr. Hanume Gowda, consultant orthopedic surgeon practicing at AHA Orthocare, Nagarbhavi, Bengaluru, specialized in joint replacements and spine surgeries. Sciatica is a layman terminology, a common man terminology for a back pain which is radiating towards your lower limbs. The lower limbs are the legs. Sometimes it can be radiating up to the thighs, sometimes up to the leg, sometimes all the way down to the toes. Sometimes these sciatica can lead to numbness of the lower limbs and also weakness. Sometimes something called a partial paralysis or a monoparesis can also happen. Okay, why do sciatica happen? Sciatica happens when there is a disc prolapse or an extra growth of a bone around the nerves. The nerve gets impinged between them. How does this disc prolapse happen? Disc prolapse can be an acute. Acute is on a single episode. You jump from a height, disc between the two bones gets slipped from there and goes and presses. That's an acute thing. Or you're going on a bike or a bus, there is a bumpy ride and the disc gets slipped from between the bones. That can lead to acute. What is chronic? People who have this lifting of weight type of job, lifting of bags or lifting of any sorts of weight, slowly over time the disc gets slipped. What is a disc? A disc is a compact packet type of thing which has got a jelly-like material of about 2 milliliters, ml, 2 cc or 2 ml. That is thick jelly-like material. Whenever the packet breaks open because of high impact or a long-term wear and tear, the jelly comes out and starts pressing on the nerves around, and that leads to the sciatica. So this is the main cause of sciatica. Then there are other causes like a growth or a tumor coming in, which is very rare. That becomes a very large topic and a different topic. For this particular topic, we will keep it as only slip disc and extra bone formation in the spine that leads to compression on the nerves and lead to radiation pain into the leg. How do we treat this sciatica pain? Initially, if it's an acute, that is just few days, give it good rest, some physiotherapy in the form of traction, and give good rest, heavy medications to relax the muscles around and reduce the pain. Sometimes the sciatica pain completely goes off without any problem. You can get back to your normal activities. If the slip disc is in a larger quantity, that is more than 1.5 2 cc's of the disc material has come out, then it will be a mechanical problem, not a disease. Then it has to be treated mechanically. Many a times it may need a surgery to remove that slip disc from that area to relieve the compression on the nerves. Other treatment modalities will be manipulations and injections into the low back, which can be done only when the symptoms are mild. If it is severe, if the pain is severe and the leg movements are affected, if your day-to-day activities is getting affected, then other than physical therapy and bed rest, if it is not relieving with this, you will have to go for a surgery. Along with this radiating pain, which starts from the low back to the legs, there can be other symptoms like numbness in the limbs, that lower limbs, legs or feet, sometimes weakness of the feet or legs, sometimes knee weakness can happen. So this is all because of the nerve damage happening. How do we treat this? The numbness, if at all we treat the cause of the sciatica like the disc problem, the numbness will go off. If there's a weakness, then it becomes a little bit of a difficult situation, because once there is a nerve damage, weakness means there is already a nerve damage. Recovery may not be complete sometimes. If it is very short duration of weakness, it may recover. If it's a longer duration of weakness, it may not recover completely. Partial recovery is done. This partial recovery happens after a surgery where the disc is completely removed and the space is made for the nerves. Sometimes it so happens that there is a lot of weakness, we remove the disc, there may not be any recovery at all. That means the damage on the nerves was already permanent because it was long standing. So by and large, if it's very early in the situation, all these symptoms can be overcome. If you do the surgery early, the numbness and the weakness can all recover completely and become a normal limb. Along with the surgery, there are certain medications which are very specific for the nerve pains that can be taken, like gabapentin or pregabalin are the commonest ones which are used. That can also help you overcome the numbness, and also to an extent the weakness can come down with these medications. After completion of treatment, that is surgical decompression, that is removal of the disc and the offending bone from around the nerves and decompressing it completely, giving enough space for the nerve. the tingling sensations or the numbness and the weakness may take some time to completely relieve. How does it happen? If it's a long-term thing, it will take a longer term to become normal. If it's a short episode like a week or 10 days, it may recover in this week or 10 days time. But if at all there is no permanent damage of the nerves, then the recovery will be complete. Depending on the time period taken for you to seek attention, the recovery is also going to be accordingly. Sciatica pain does affect sleep sometimes. If you keep your limbs straight, completely straight, it does lead to a little bit of pain. Ideally, we call it baby position, that is crouching position. Bend your knee, bend your hip and sleep. The pains are less in sciatica when you sleep like that. Sometimes it is so severe that disc prolapse or the bone compression is so severe that even with any position you become very uncomfortable and it's difficult to sleep. It will start disturbing your sleep. If that happens, please seek attention, get the surgery done at the earliest to get relieved from all these pains. There is not much you can do as a home remedy for sciatica pain other than taking painkillers and probably a little bit of stretching of the muscles around the hip joint. If it's a very mild sciatica, stretching the muscles around the hip joint, stretching the joint of the knee joints will probably help a little bit, but there's not much that you can do as a home remedy for sciatica pain. So it's usually a mechanical problem, it's not a disease, so it has to be treated mechanically. Mechanical is if the compression on the nerves is severe, the compression is removed either by physical method or some sort of therapy, it has to be removed, then only you get relief.